All right, guys, thanks for joining us here on a Wednesday afternoon. I'm Blake Webb. I'm one of the neurologists here at Southeast Veterinary Neurology, and we're going to be doing our third breed breakdown. And this week, I think we are doing Dachshunds. So a lot of people's favorite breed. They are very, what we call big dogs and small dog bodies, and they love to try to do things that their little bodies probably shouldn't be doing. So we're going to talk about some of the more common neurological diseases that they get, and we'll go through the top 5. So now that we've had a couple of people join us here, we'll go ahead and get some things started. So give me just a moment to get to the pictures here. So the first one we're going to talk about is disc herniations or intervertebral disc disease. So this is one of the more common things that we see in Dachshunds, as many of you know that follow us. So what happens with intervertebral disc disease is that the disc in these breeds, along with Frenchies and some others, degenerate very early in life. So they no longer are fluid filled, they become calcified and hardened, and there are some genetic components to this that they found in some of these breeds. And as those discs become really hardened and no longer can be nice shock absorbers, they can herniate and rupture. They get just enough pressure and they can't take it anymore. So we have a nice little MRI picture up here of what that looks like and what we see here on our side. So this is an MRI image. Right where the arrow points down, you can kind of see a black hole type of area. That is actually the disc bulging up there, and that thin gray line that gets a little pinched and comes down is the spinal cord. So as you can imagine, you can see some pretty significant neurological signs with these patients, and it will depend on kind of where the disc is in the body. So we can have disc herniations in the neck, and we can see all 4 legs become extremely weak or even paralyzed. If we have them further down in the back, so kind of more thoraco or lumbar region, we can start to see the back legs become very affected. The front legs will remain normal and they can walk, but we can see paresis or paralysis in those back legs. We have some fun videos, I think, for you here to kind of show you the differences of some of these intervertebral disc dogs. So the first one we have here, so this is a little dachshund here. So as you can see with this guy, he's had a disc herniation in his mid to lower back, probably what we would call a T3L3. So those front legs were working great, back legs were not. This poor little guy has had one in his neck, so you can see all 4 of those legs are not working as appropriately as they should. So we'll let those kind of go through here. So a lot of people ask, what can be done? Where do we step in as veterinary neurologists? So the most important things that we can do is if you ever notice that your pet is unable to walk or gets to where they are walking inappropriately or not normally, is have them come in so that we can see them, evaluate them. We'll do a full neurological exam, try to pinpoint where's the problem, neck, lower down in the spine, and then talk to you about what potential causes could be happening for your pet. If it's a dachshund, we'll probably talk a lot about disc herniations and disc disease, but there are some other things that could be at play. The next step for a lot of those patients, depending on their severity, may be to do an MRI, as that image is there in front of you, to go and look and see which disc is it specifically. Depending on, again, the severity of the signs, we do have 2 different treatment options for these patients. One being medical management, so we put these guys on strict rest and confined to a kennel or at least an enclosed area. And then we give them lots of pain meds and anti-inflammatories to give the body some time to scar down that disc to try to heal it up the best it can. And then we check those patients back along the way. The other option that we have for some of these patients is surgery. So depending again on how severe this patient is, that might be the only kind of option that we have. So we will actually go in, remove a little window of bone, expose that spinal cord and that disc herniation, scoop that material out, allow the spinal cord to go back into a more normal and happy spot, and watch that patient again, watch their kind of progress. Generally, we should see them improve. Worst case scenarios for these patients is if they become deep pain negative. So that means that the patient has kind of suffered the most extreme injury that they can, and they can no longer feel their toes in those back legs, even if we pinch really hard with hemostats. For those patients, when we get to surgery, we're talking about a 50-50 shot of making a recovery. And with medical management in those situations, we're talking less than 5% generally will make a full recovery without having surgery. So we've talked a lot about disc disease. It's a really common one that we see here. Talked about it at all the breeds so far, but very common and unfortunately very overrepresented in our breeds here. So we're going to talk about some new diseases that we haven't covered in some of our other breeds that, again, are predisposed in Dachshunds. So one is a pretty rare disease, but is genetic in wire hair miniature Dachshunds, and this is called Lafora's disease. So this is actually what we call a lysosomal storage disease. So the cells in the brain are unable to get rid of certain waste products, and they build and build and build in these cells, and they start to cause problems because these cells will eventually die because they kind of become overcome with this waste material that they can't get out. So in Lafora's disease, what we'll see is generally in Dachshunds, it will occur later in life, and they will develop what we call a myoclonic epilepsy. So seizure activity that's rhythmic muscle contractions in nature. And generally they are, like 7, 8, 9 years of age by the time they start developing this. Unfortunately, like a lot of lysosomal storage diseases, there is not a definitive cure for this, and diagnosis can be really hard. Generally, we base it on the breed and the clinical signs, but the only way to definitively diagnose this is to go and kind of look for these changes within the cells in the brain. So I have a nice little picture of some of those for us here. So this is actual histopathology or brain tissue that's been collected after death for a patient. So we have some nice colored stain slides that should be on your left, and then we actually have some black and white slides that are on the right. So on the left, this is general tissue that's underneath a microscope. These very bright pink areas in the top left one is brain tissue, and those bright pink structures are actual Lafora bodies. These are waste products that are congealed within these cells. To the right, top right picture, this is electron microscopy. So basically as small and as detailed as we can get in looking at tissues, you can see the LB labeled there as a Lafora body. These can develop elsewhere in the body. So the bottom two squares here on the left and the right is actually within the liver. So you can see some liver cells here, and they've also developed these Lafora bodies that can't get rid of this waste product. So like we said, for these, unfortunately, prognosis tends to be a little bit poor, and at this time we don't have a great way of treating this, similar to a lot of the other lysosomal storage diseases, both in people and in animals. All right. So we're going to move on to our next one here. So we're going to talk a little bit about Myasthenia Gravis. So give me just a moment, and I'm going to find our video here. So Myasthenia Gravis is also something that Dachshunds can be predisposed to. There's two forms of myasthenia. So myasthenia is overall a generalized weakness is what we're going to see in the patient. There's an acquired form, meaning that you've acquired it later on in life. And in these patients, the body starts making antibodies against a receptor on your muscle, and your nerve and your muscle can no longer send signals normally, and you start to get weak. And that weakness is made worse with exercise intolerance. That's what we're seeing in this video here with our cute little dapple dachshund. So as we continue to walk this patient, we start to notice almost like a lameness. She gets very short-strided, and eventually she just sits down because she can't keep going. And this is something that's repeatable and can be made happen again and again if you exercise these patients. For Dachshunds, they tend to get the other type of Myasthenia Gravis. They tend to get the familial or the genetic type. So this is actually something that happens very early in life, and instead of an antibody attacking the receptor, these patients are just born without a receptor. So again, the nerve and muscle just can't communicate as well as they should, and we see a lot of profound weakness in these patients at a very young age, generally around about 8 weeks or so. For those patients, generally we don't have a great way of diagnosing it. We can't look for the antibodies that we have in the acquired. We can do some biopsies of some muscles around the ribs and send those out, and basically they look and say, hey, these receptors are absent, and we can try to diagnose the congenital or familial form of this that way. We generally will treat both of these forms with a medication that tries to help the signaling from the nerve to the muscle and stimulate that signaling and make these patients stronger. In the acquired form, we can watch these antibodies. Hopefully the antibodies go down over time and they may convert, what we call. So they no longer produce these antibodies. The patient can come off of the medication sometimes and do well. Relapses can happen. For the congenital form or the familial form, generally these are lifelong medications for the patient because they don't have that receptor. There are some reports of Dachshunds getting better after a few months and no longer needing medication, but they're kind of more of the exception than the rule there. For these patients, we don't have to do a lot of fancy imaging, but we may do some blood work and some x-rays. For all myasthenic dogs, we want to make sure that the muscles of the esophagus are working well. Sometimes that esophagus can be dilated, what we call megaesophagus. These patients are very prone to vomiting and regurgitating food, so we may need to sit them upright. They may develop pneumonia, which will be a secondary complication for this disease, and we want to make sure we watch those patients closely, make sure that we keep them in a safe place. All right. So we're going to talk about another kind of rare, but overall a very interesting disease to see. So unfortunately I don't have one of a Dachshund, but this is a little Frenchie. And the next disease that we're discussing here is Cataplexy or Narcolepsy. So this is a disease where we have a lack of production of a hormone in the brain that's called hypocretin, and or a lack of the receptor to respond to the hypocretin. This hypocretin is a very important hormone that helps in our sleep-wake cycle and helps with stimulus and keeping us alert at all times. So if you have a patient that has narcolepsy or cataplexy, they don't have enough of this hormone or they don't have enough of the receptors, what you can see is they can go into this almost catatonic sleep-like state really quickly, and a lot of times it is produced by excitement. So as we can see our little Frenchie here, he's super excited, he wants to play with these toys, he knows he's going to have fun, his excitement level goes up and he's unable to really cope, and he goes down and kind of goes limp. So this is a really kind of wild disease to see. It is pretty rare. I've only seen one in the last 6 years or so. So when we see these types of patients, we want to try to work them up and look and see if there's an underlying cause. Rarely, you can have masses within the brain, or you can have inflammatory disease within the brain that precedes this, but a lot of times this can be genetic. And again, talking about our Dachshund friends, they tend to be familial or genetic and have a lack of the receptor here. Doberman Pinschers are also overrepresented as a genetic, a breed that has a genetic propensity for this. So we'll work these guys up. We overall do MRIs, CSF taps. We can test the spinal fluid with that CSF tap, look for this hypocretin, and try to fully diagnose it if it's present, or treat an underlying disease if that is present. Treatment options for these guys is a bit tricky. We don't have a great treatment that completely kind of cures these patients and takes them 100% back to normal, but we can try to add in antidepressant medications that can kind of help stimulate this hormonal production, the top one being imipramine. So we'll add that in and try to help keep the patient from having these catatonic, cataplectic types of states. And sometimes we can also add in some stimulants if they need more of a stimulation. So a lot of these patients may be excessively sleepy on a day-to-day basis. They may be actually really hard to rouse if they do go to sleep, so you have to really, really shake them and try to get their attention. So these are all drugs that we kind of have to tinker with and find the best concoction for each patient there. All right, so moving through here, we're going to go to our last big disease that we want to talk about. So The last one that we're going to talk about is cerebellar abiotrophy or cerebellar degeneration, depending on what you look up and when and where. So this is a disease where the cells that help our balance system begin to die off earlier in life. Sometimes it'll happen a little later in life, but earlier than they should nonetheless. And our brain is not able to take in the input from our nerves and send out appropriate signals to help us maintain our balance. So for patients that have cerebellar abiotrophy, we are looking at dogs that are off balance, falling to one side. They may be circling. They may also have a fine head tremor and can't seem to quite be still and steady. And generally, they'll be just incoordinated in general. We have an MRI image here, so if you look at the very top image, the larger full brain here, this is a normal brain, and if you look to the far right, there's this little bush-like structure that's nice and round, and that is the cerebellum. So it should be a nice dark gray structure with a little bit of spinal fluid kind of around those little leaves that it has. If you look at the bottom picture, it's kind of zoned in on that cerebellum or the back part of the brain, you'll notice that that structure looks a lot more shrunken in. It's not normal and full like it should be. And you'll see a lot more of the whiteness, which is the spinal fluid that's kind of filling in as that brain tissue shrinks down. So again, for these patients, as you can see, the thing that we're really going to want to do to try to get the best diagnosis would be to do an MRI and go and look at the cerebellum, because there's other things that could make a patient kind of show those same balance signs, such as a stroke, inflammation, cancerous processes, infection within the brain, and an MRI, generally paired with a spinal fluid tap, is going to be the most helpful to try to pick up all of those things at once and see which path that we need to go down. For some of these breeds, especially kind of like Staffordshire Terriers, kind of like pit bull types of breeds, this type of disease actually develops much later in life. So they may be 8, 9, 10 years old before they start showing these changes. When we have worked them up and we can see some of these changes in the atrophy, we do have some genetic testing that we can send out to try to prove for some of these breeds. It's not available for everyone just yet, to try to prove that this is degeneration and give the best possible answers to clients. So unfortunately, similar to kind of our lysosomal storage diseases, there's not really a definitive treatment for these patients. A lot of these patients, unfortunately, will progress and get a bit worse over time, and we kind of monitor their quality of life, try to add in safe environments, keep them protected as best as we can. Sometimes physical therapy can at least help them a little bit, but we do kind of sometimes see them decline, and we have to be mindful of that when that happens. There are some patients that will kind of stagnate, so they'll reach a level where they don't worsen anymore, but they're not going back to normal, and they'll kind of stay at the same level. So as long as they're kind of happy and otherwise doing well at home, eating, drinking and stuff, and they're just a little bit wobbly, we can allow those patients to just be as they are. All right, guys, I think that's all the information that I have for today. So I'm gonna open this up for any questions that you guys have. Give me just a moment to get this switched over. All right, so we have our first question here. So we have, what causes Dachshunds to have these neuro problems? Is it their long bodies and their short legs? So that's a great question. So specifically for disc herniations, we do worry that there is a genetic component to this. So we have kind of bred them to be long-backed, short legs, and have we induced some gene changes? It's definitely possible and probable, but there is a specific gene that they have found for a lot of these degenerative disc diseases. Frenchies kind of share it. Duck-tolling retrievers as well have this same kind of mutation. So it is unfortunately genetic and not something that we can take away from a patient if they are predisposed. So that's a great question. All right, want to pull one up for me? Just go here.
Yes.
All right, and then just hit it.
Mm-hmm. There's also some in the comments if you want to do that after.
Sure, yeah, absolutely. Okay, so just making my way through the questions here. Sorry, I am technically challenged. Is there a way to detect narcolepsy without an MRI? So, yes, basically we just look at the clinical signs. I mean, a dog that goes into these cataplectic, limp noodle types of states with excitement is overall pretty diagnostic that, hey, there is at least cataplexy, this like weakness that's happening with excitement. To specifically diagnose narcolepsy and to make sure there's not another cause, you generally are going to have to consider doing an MRI and spinal fluid taps. There are some genetic tests that could be considered, but to make sure there's not something else, the only way we can really look into that brain is to do an MRI. So awesome question there. Thanks. All right, I'm going to go through.
There's some over here if you want to answer.
Absolutely.
Why is it so important to evaluate surgery and do it in the first 24 hours?
Absolutely. Okay, so I have the next one here. So the question is, why is it so important to evaluate a patient for surgery and to do it quickly? So the main thing that we worry about is how severe are the signs for this patient. So specifically for Frenchies, but sometimes in Dachshunds, we can see a rapid worsening for these patients once they have had a disc herniation. So part of the disease process is that disc will herniate and it causes compression. It's pushing up against the spinal cord, but it can also cause a really bad bruising and a lot of inflammation. So the goal of surgery is to remove the compressive part of that, allow the spinal cord to breathe, allow blood flow to come back through that tissue, and to help try to clear up some of that inflammation. The main things that we worry about is if dogs go down and they continually get worse, they go from weak to plegic to not being able to feel their toes. If they get to that point and they come to us, we're only able to really kind of offer a 50-50 prognosis with surgery because they've had pretty significant neurological damage to that spinal cord. But if we can get them when they're walking, they have a much better chance, so 90 to 95%, or even if they're not walking but can move their legs, they still are in that 90 to 95% chance. So that's why we like to address these as soon as possible, to try to stay off some of the worsening and to try to stay off some of the severe side effects that can happen. So this is a process that's called myelomalacia. This is when we have a very severe spinal cord injury and you have inflammation that will go up and down the spinal cord. It is unfortunately irreversible. There is no treatment, and most often that is fatal. So that is something that we try to avoid. It can happen, unfortunately, in very severe cases, even with surgery. So these are things that, all the more reason to get evaluated and have a neurologist kind of go over these and what they think the chances are of that happening. So great question there.
Can I get another herniated disc after being paralyzed, or get paralyzed after?
Absolutely, yeah. So we have a question here that a patient got a surgery a couple of months ago for a disc, and can that herniated disc happen again, and can they re-go through the same signs, weakness, paralysis, not being able to walk? Unfortunately, the answer to that is yes. So depending on the breed, there's reports out there anywhere from 10 to 30% of patients that have had a disc herniation can have a herniation again later in life. So the concerns is that, again, this is genetic, so it's not just one disc that may be affected by those genes. There may be a multitude of discs, both within the neck and lower down, that may be aging and having those changes all occur at the same time. So definitely it can happen again, unfortunately. Something that we can do to try to combat this is if we have a patient that does have a severe enough disc herniation that does require surgery. A lot of times, as long as it's safe, the patient's doing well, some other factors may be at play, but we can fenestrate discs during surgery. So what we'll do is we will take a blade and cut into the disc from the side and try to remove some of the material with some special instruments. The thought process behind that is if we put a hole on the side of the disc, if it ruptures, hopefully it won't go up to the spinal cord, it'll go out. We also remove some of the disc material, so you're decreasing the amount of disc that could herniate. And also if we're doing some of our scraping techniques, the thought is that you can kind of scar down that disc and basically kind of kill it and again prevent it from herniating in the future. Obviously, we can't do that to every disc in an entire dog in a surgery. It requires a lot of muscle dissection, and obviously that's uncomfortable. But generally, we can reach a few around that area and take care of those. We'll try to hit the ones that are statistically the most likely to herniate, and again, just try our best to help those patients out and hopefully prevent them from seeing an operating room again. But unfortunately, just a potential for them later on.
What can cause random head bobbing in Dachshunds?
Awesome. So we had another question about what could cause random head bobbing in Dachshunds. So there are a potential of a number of common causes for head bobbing. So one that we see very frequently is what we call idiopathic head tremors. Again, more common in like Dobermans and English bulldogs and sometimes French bulldogs, but can happen in any breed. And so for those patients, they are generally very neurologically normal. Their exam is unremarkable, but what the owners will see at home is they will go through periods where they head bob. They can do a yes/no. They can go wobble sometimes, but they'll do this for a few minutes. Sometimes it can last up to a few hours depending on the situation and the patient, and then afterwards they're completely normal. They should always be conscious during these events. They shouldn't urinate, defecate, or drool. If you see those types of things, we're more worried about seizures. But other things that could cause tremors in patients would be things like cancerous processes within the brain or inflammation within the brain, either from infection or some autoimmune meningitis could potentially all cause some tremor-like activity. So again, having the pet evaluated by a neurologist, having that neuro exam, is this dog otherwise normal or does this dog have other signs, would help us try to differentiate what we may be dealing with and whether or not an MRI would be what we want to pursue for that pet. All right, and we are also, I was reminded we are going to be doing a blog on tremors, so I'll be recording a video later on. So we'll talk a lot more about some of these tremor episodes, and we'll go into some more detail about some of those specific diseases. Another great question that we have here is, my dog just had surgery last Saturday for a disc herniation. What is the time span of recovery for this? So this is one of the most common questions that I get from owners, and the answer is it takes the patient the time that it takes the patient. So it depends on how severe were they beforehand. Were they able to walk or able to move their legs? Those patients generally will recover a little bit faster. I generally give them about 5 to 7 days in hospital to see where they're going to go, and we generally see a slow improvement day by day. Sometimes dogs that have had a disc herniation in the neck recover super quickly. Once you get that disc material out, sometimes they may be walking in a day or two and much more comfortable. So they tend to be faster than some of the backs in the lumbar spine. If a patient is more severe, they've lost pain sensation or something along those lines, they're at a 50-50 chance of making that recovery. Some of those dogs may take a month or 2 months before they show us what they can fully do. So I never count them out for a while. But the longer a patient stays deep pain negative, the longer that a patient cannot feel their toes, the worse of a situation that may be. Again, I've seen some dogs recover much later down the road, a month or two, but I generally like to see those dogs start showing me they can feel their toes within about a month. Great if they do it faster, but if they do it within a month, I am at least encouraged that we are still going to have some more improvement. Any dog that's had a disc herniation may show improvement 6 months, a year down the road, especially if they're doing some physical therapy or some additive treatments to try to help them along. So I like to see great improvement in 7 days to a month, depending on that situation, but they may continue to improve. And it is all very dependent on the patient, how bad they were, how many discs, how many sites, those sorts of things. So very, very variable. Alright guys, just looking to see if we have any other questions here. So another one here, this is a pretty good one. So how can you distinguish between vestibular disease and cerebellar abiotrophy? And so that's a great question, and another one that I get really commonly. So the thing that we have to remember about vestibular disease is this umbrella term that means balance dysfunction. there's tons of things that could cause your balance to be dysfunctional. So vestibular disease, what we like to do is do an exam on the patient, and we try to put it into two categories. So one is it peripheral, meaning is the inner ear structures being involved, or the cranial nerve 8 involved, and is that why the patient's off balance? So things like ear infections, sometimes low thyroids, some types of cancers can get into the ears, and then sometimes we have idiopathic or unknown cause, especially in older patients, and they will be peripheral in nature. So they don't have mentation changes, their other cranial nerves aren't involved, and they have great paw placements in their feet when we knuckle them over. The other category is central. So if you have balance dysfunction and this patient is mentally inappropriate, or there's other nerves in the face region that are not working appropriately, and if they have that knuckling behavior, this absent paw placement behavior, those would be patients that we'd be more worried about central, meaning that the parts of the brain that take in all this information and maintain our posture are not functioning well. And when you have patients like that, you start to worry about Cerebella Abiotrophy, you worry about strokes, you worry about cancer, you worry about inflammation. There's some other less common types of diseases. Toxicities can even be on that list. So those would be things that you would worry about, and you want to use your exam to try to distinguish which of those. But there's a lot of research that shows sometimes even on the exam, it can be questionable whether this is peripheral or central, or maybe it was an ear infection that started peripheral and then it actually crossed over into the brain and is causing meningitis. Now it's central. So an MRI is going to be the best tool to go and look at that brain. You also will see some of the inner ear structures and say, do I see an ear infection? Do I see tumors? Do I see a stroke? And then we're able to give better information of what caused that vestibular disease. I hope that made sense, but it's a complicated tree of figuring things out that we see. Last little question we have here is it common to have some random strong kicks after disc surgery? So, I mean, it's definitely possible. So a lot of owners become very hyper-vigilant after these surgeries. They want to watch for everything, and that's great. So I would always report that to your veterinarian or to whoever is handling your pet for disc herniations, whether that's your neurologist or your family vet. So sometimes they may have some residual pain. If it's shortly after surgery, you may see some tremors, even some muscle fasciculation. Sometimes they may do a kick, but dogs can also have a lot of behavioral things. They may want to cover up when they've gone to the bathroom. So it can be really hard. Always video recording these types of more weird behaviors can be super helpful, and showing those to your vet so that we can kind of see what you're seeing at home. But ultimately repeating that neuro exam, making sure there's not worsening changes on that exam, post-surgery or from the first time that they evaluated the pet, if they're being medically managed, can be really helpful. All right, guys, so I'm just going to check and see if there's any other questions here. So I have one other one here, and is could a dog experience Laforas outside of adolescence? So yes, it's definitely possible that some of them can present much later in life. Dachshunds have reports of doing that and being present more later in life. These Laforas and these lysosomal storage diseases are not 100% fully categorized as to what 100% causes it. So there's some overlap in dogs that do it early and some dogs that do it late. As science and research moves on, we may be able to kind of better distinguish which of these we're dealing with. But absolutely, it could happen later in life.
Can you answer the ones about physical therapy? When should they start physical therapy after surgery?
Yeah, do you have them on here?
Yes, they should be there.
Okay. Sorry, we're just searching for a good one here.
When can we sign up for physical therapy classes, and how soon after surgery can they start?
Okay, got it here. All right, so great question here regarding physical therapy. So where can you sign up for physical therapy classes, and how soon after surgery can they start? So that is kind of case dependent and also doctor dependent. So generally for my patients, once they have gone through a back surgery, or even if we're just doing medical management and they're just on rest and pain meds, I like to generally rest them at least 2 to 3 weeks for surgery patients, and sometimes 3 to 4 weeks for the medically managed patients. The reason being is if they've actually herniated the disc, there's still a hole there and more herniation can happen. So you want the patient to be very still and allow the body to put down the scar tissue and hold everything in place as best as possible before you introduce more activity and potentially make them herniate again. So for me, it's case dependent, but generally I'm going to wait about 2 to 3 weeks before I push a patient to physical therapy. Physical therapy can be super beneficial in helping the patients recover strength and also coordination, so we can work on that proprioception, that awareness of where our feet are, as well as strength. So underwater treadmill is the very popular one that everyone likes to see and wants their pet to get, but there's also great land-based therapies, cavalettis, balancing boards. There's a lot of other training that we can do outside of just the water treadmill that can be super helpful. So if you have a pet that's had disc herniation or has arthritis or even has an orthopedic surgery, any of those patients could potentially benefit from PT. I would talk to your vet or your surgeon or your neurologist, whoever was working and managing that problem for your pet, and ask where they would recommend to go. We do have physical therapy services here at SEVN, so we generally offer that for our patients here in the hospital.
That should be good if you're...
Okay. I'll do one last question here, or I have two here, so I'll do two real quick and then we'll wrap this one up for the day. So how far is it safe for Dachshunds to walk? So again, very dependent on the patient and dependent on the situation. For my post-surgery patients and also for the pets that I'm managing medically, I'm not going to allow them to do a whole lot of walking. They need to be confined to a crate or a kennel for probably most of the day, 23 hours out of a day. I allow them to go outside to go to the bathroom. Sometimes they'll need to be carried. If they're doing okay, I'll tell the owners it's okay to walk them outside, but always on a harness, not a collar, and always attached to a leash. They're not allowed to run around in the yard. We don't want them chasing iguanas here in Southeast Florida or squirrels in other areas of the world. We want them to be still, do their business, and then go back into their rest. Once the patient has progressed through that rest stage, a lot of times I will recheck them again, make sure we're comfortable, make sure we're moving in the right directions, and then I will actually write down some specific instructions of they're allowed to be out in the house with you now, but still no jumping, no stairs, and then we'll do a slow reintroduction to activity. So week 1, every day they can do 5 to 10 minutes, 2 to 3 times a day on the leash and the harness. Week 2 will go to 10 to 15. Week 3 is 15 to 20. Week 4, 15 to 20 or 20 to 25. And then after that, I kind of let them go back to their normal activity. And we generally will try to refrain from high impact stuff. So no jumping on and off the couch. Try to avoid large flights of stairs. No jumping in and out of cars and things like that. So that's a great question. All right, so the last one here is trying to prevent another disc herniation for a pet. What options are there, specifically weight management, no jumping, no long walks, etc., to try to avoid another surgery. So unfortunately, there's no way to 100% avoid this from happening as much as we want it. Even we would want to avoid having to do these surgeries for patients again. But trying to avoid those high impact things is generally the best we can do. So no high jumps off of furniture, no jumping in and out of cars. Try to prevent them from bounding up and down a flight of stairs from the first to second floor. It's hard as owners to try to prevent a dog from doing that, and I know that from experience in resting my own dog. So at some point we like to do more activity, but we just want to make sure that they're safe and that they're comfortable before they try to do those activities. So rechecking with your neurologist or your vet along the way can be super helpful to make sure that they're ready to go back to some more activity. All right, guys, so I think that answers a lot of the questions that we have on here. I hope you enjoyed it and had some new thoughts and some things to learn here. If you guys have any other questions, feel free to reach out to us, but I'm sure we'll be doing another breed breakdown here soon. And watch out for our video on trimmers.